Let's talk about possible causes of limited ankle dorsiflexion. What are the possible reasons and how to manage it considering physiotherapy and exercise. So dorsiflexion limitation, it can has lots of reasons. The most important thing is when people make severe injuries of the ankle, like severe like ankle fractures or Achilles ruptures or tears, where they have been into immobilization for 6 to 8 weeks of time. Anything which just needs immobilization to the ankle area definitely can result in limited mobility to that area. So but that is not the only reason. There are lots of other factors associated with it, which means just acute ankle sprains or repetitive strains and sprains to the ankle. It can lead into limited range of motion for the ankle. Let's just have a little overview and understanding about the anterior talofibular ligament, which is definitely attached to the fibula and the talus. So any repetitive stress or loading on the anterior talofibular ligament or any chronic scars or adhesions to that area will definitely alter how fibula is moving. So you will see a lot of anterior translation of the fibula in patients, those who suffer with any kind of biomechanical compromise for anterior talofibular ligament. So that is another reason. And again, other than injuries, what else could be the reason where people struggle with ankle dorsiflexion is just repetitively doing ankle dorsiflexion again and again over the activities which involves I should say running or jumping. So such kind of sports related activities where you need to have back and forth repetitive dorsiflexion. So that could be another reason people struggle with anterior ankle impingement, and they always feel pain when you ask them to do dorsiflexion at the ankle because of excessive scarring at that ligament, which is anterior talofibular ligament. So how to manage that, and let's talk about what is the normal range of motion for ankle dorsiflexion. So normal range of motion for ankle dorsiflexion, which most of the schools are saying is 20 degrees, but it can vary from 15 to 18 degree up to 20 degree or 15 to 36 degrees according to different school of thoughts. But American Association of Orthopedic Surgeons, they have said that, and that's the latest update about how much is the normal ankle dorsiflexion, which is 20 degrees. So how to manage? Let's talk about three important components to address. One is myofascial release technique for the calf muscles and plantar fascia. The second important thing is calf stretching exercise. The third thing is strengthening exercises for dorsiflexion, doing ankle drills. So this will be the only criteria when it comes to rehabilitation or to regain the ankle dorsiflexion. So let's start with the first step, which is myofascial release for the calf. So when we talk about myofascial release for the calf, let's talk about, if I'm focusing on this is my treatment side. So this will be my good side. I can adjust my good side according to my comfort zone. You have a foam roller under your calf area, and your hand placement should be here so that you really can lift your bottom up. So what you need to do is you need to lift your bottom up and you gently try to slide back and forth throughout the whole length of your calf muscles, and you need to continue doing that activity for up to a minute time. So not only just over the direct belly of the calf, but you can engage the lateral calf area by moving your foot into external internal rotations, more like ankle circles. I think I should stay here so that you can see me better. So lifting your bottom up and then trying to engage the outside of the leg muscles, and then just ankle circles, moving your toes inwards and engaging the inside of the calf. And then another technique is while you are doing that activity, let's assume that you have find out a trigger point, hyper irritable spot into the calf area, and you want to apply a direct ischemic compression, a constant pressure. So what you can do is stay into that position and add a continuous compression on that trigger point. You can shift your body weight more. You can challenge the area further by loading it with your good side, and then whether you can slide or whether you can stay, which means just a static compression. That is one technique. In between this time, if you are adding a constant static stretch, you can add dorsiflexion. While there is a constant ischemic compression on the trigger point area at any spot, you are adding dorsiflexion. So this is very interesting and very important when it comes to myofascial release technique for the calf. Let's move to the second step, which is calf stretching exercises. So what we need to follow when it comes to calf stretching. So we have two methods to engage calf for active stretching exercise, which you can guide to your patient. Let's assume that you're standing in front of a door frame or a wall, and that's my treatment side. My foot is just placed in front of a wall and I'm a little bit on distance. So what I need to do is I just need to lean forward while bending my leg and back, and try again. Keep bending your knee to the point where there is a direct contact between your knee and the door frame or wall. Feel enough stretch into your calf area. You can stay there. You can stay there up to 20 seconds. Coming back. And again. That's the one way to work on active calf stretching. You can hold for 20 seconds. The time you start feeling stretch into the calf area, you need to hold for 20 seconds and then relax. You can try 10 to 15 times, morning and night. Another way to deal with the calf is, I'm still working on the same side. So I'm just trying to have a direct contact through my forefoot with the door frame, with the wall. Okay. Now, you're trying to lean forward, just bending through the knee. Okay. If you keep your treatment leg straight, you can lift up through your other side, reach to the point where you started feeling enough stretch into your calf area. Hold that stretch for at least 20 to 25 seconds and then you can relax, and then you can try doing this exercise for 10 to 15 times morning and night. So that is the part of stretching exercise. I really want you to understand you need to feel stretch before you come back into your relaxed phase. The third phase was adding some ankle drills. That is more like a strength training. So for that, there are lots of ways to improve or just build up strength into the ankle by using external weights in the form of maybe kettlebell, or maybe like I just have got 1 kg of ankle cuff, which I will be using here. What else you can add is you can do some resistance bands exercises. So let's take an example of, you are having a 1 kg weight. Okay, now coming to the ankle drills. I have got 1 kg weight, and what I need to do is, I'm just sitting straight. This is my treatment leg. You really need to just bring it straight to the point. I think I should move my camera a little bit more further so that you can have a look on what I am doing. Okay, now you're sitting straight. You have 1 kg weight just around your foot area. You are going into full leg elevation, knee extension, and then at end range, you are doing ankle dorsiflexion. Come back, going again, into full leg extension, and then doing end range dorsiflexion, and then slowly coming back. At least 10 to 15 reps you can do. There is as such no hold time, but 10 to 15 repetitions, 3 sets per day. That's one way. Let's take the weight off. Let's take the weight off, and you're still working into dorsiflexion. So just seated toe raises. Seated toe raises. Very gentle. You need to be very slow. The more slower you are, the better control you are trying to develop into the muscle. Toe raises. That's another way to deal with that. Another way to improve the ankle dorsiflexion and keep just building up strength into the ankle is ankle push-ups. So which means for that, okay, I think I should be here so that you can really see me. So you're just on your hands. Now, if right leg is my treatment leg, I need to just come into dorsiflexion and back, dorsiflexion and back, and dorsiflexion. And same thing, you can revise for your other side. Let's assume that you're working for your left side. Then, so from here to push-ups, slowly going back. So that's the another way. I hope all these tips will help you to guide your patients rightly, or if you are a person who is struggling with ankle dorsiflexion, you can have a look on my videos. Thank you.